This video, we're going to go through billing for our patients. So we're back to our patient here, and I treated her today. You're going to just scroll down. Remember, this was the code we used. Sometimes I'll put it in my notes just so I can remember. This is the PT treatment code or the OT treatment code here. I just put that in for myself. And then on insurance info, you're going to allow editing. First, you want to start with, let's see, the billing code. I think that's that. Yep. All right. So we did 4 total units. 2 were neuro re-ed. Actually, I typed that in wrong. 97112 is neuro. And she was one of my original patients. She's at our 185 rate. So to know what the individual unit is, you would do 185 divided by 4. So we have a lot of codes in here. It's 46.25. If the patient had a session that was 205, it would be at this 51.25. And we've had some different eval prices, so that's why there's all these different ones in here. So we did 2 units of neuro. I'm going to just change that to 2. You want to add your treatment diagnosis. So this is the muscle weakness generalized. This modifier, if you're an OT, it should say GO. If you're a PT, it's GP. 97140. We did manual for 2 units. And then we want to make sure at the bottom that equals what we charge the patient. So that equals 185. Going to scroll to the top and email the super bill to the patient. We send all of our patients super bills with the exception of Medicare, Medicaid, and we'll go through that in a different video. So she's all set. I wrote the note with the SO, and our objective is just the treatment and the billing, A and P, and then I sent her super bill. I gave her some stretches. I have a template of stretches on Canva, so I just sent her, I emailed her some Canva stretches too, and she's good to go. She's booked out. Let's go through some different options. So we have some different eval prices, and it's probably going to continue to change. But let's say, okay, so actually this is an okay example. So for Jan, say her evaluation was $85. So say she came in today and this was her eval. So for her super bill, it's going to be down here, and it's not going to let me edit it. But her super bill is going to still have this code, but you're going to bill 1 unit of the initial evaluation at 80, so the rate would be 85. Let me see if I can find a better example. Let's find one on Lexi's from last week. Okay, here we go. Here's an eval. So let's go through this. So this patient, here's her intake form. She did her eval, and we don't need a medical diagnosis here, but treatment diagnosis. And then Lexi likes to have all these different categories: family history, bladder history, bowel, sexual, other. She filled all this out. This patient was referred from Mid-Michigan OB-GYN. So then we typically, if they're a referral, we'll send the note to the doctor. The admins will send it later in the week to the doctor that referred. And plan of care, this is just kind of, we have the same thing set for every patient. You could change this if you want, but it's best if we aim a little higher in case the patient stays longer. And then you would sign the note, like down here. Remember, for that first day, you're going to have daily note 1. So this is still on her eval, daily note 1, see eval. Here's her eval code, 97166, OT moderate complexity eval, see eval. Okay, so she actually has her next note prepped. But for her billing, so she just did, here's the notes, she just did 1 unit for the eval. She didn't do any treatment. So you can see she put in this code, 971660 or 166. Eval is 85. Here's the code, GO, and that's what our evaluations are right now. 85, so that's correct, and that's what she charged the patient. This patient actually purchased a package, which we'll go back and talk about packages in a minute. If the patient, let's see if she did any treatments with any of her evals. I think they treated on this one. Let's see. Nope. Let's see if she treated on this one. No. Gonna keep looking here. No. Okay, well, I'm gonna just verbally explain. So, say she treated. We want our treatment units to always stay the same, but our eval unit can change. So, if she's just billing 1, we need it to equal 85. So, it's gonna be 85. Let's see if I can pull up a document and show. Okay, so we always need the eval to equal 85. If she actually did 1 unit of neuro, and then the eval code is always 1 unit eval, she did mod code 97166, and we need it to equal $85. So this is the one that can vary. This one we always need to keep the same. So that is going to be the $51 rate. Let's see. So 205 divided by 4. 205 divided by 4. 51.25. And so we need this eval code to make up the rest of that. So 85 minus 51.25 is 33.75. So you'll even see in here, let's see, my computer's going cray-cray. No, that's not going to show us. So we would bill, her eval would only be $33 because she did 1 unit of neuro at 51.25. So those would be the ones she billed. If you did bill 2 units, like say you did 2 units of neuro, but our rate is this 51, that's actually not going to work, 51.25 times 2, because it's over 85. So for those notes, it's pretty unlikely you're going to bill 2 units on the eval, but if you did, you can put it in your note that you did 2 units, but when you bill the insurance, you're actually going to just bill 1 unit of neuro. It's a little confusing because of the packages. So if a patient purchased a package, which means that their visit price is $185. This is assuming they're doing the 205, right? If they purchase a package, and now the new rate for each visit is actually $185. So $185 divided by 4. Now for the eval, we're actually billing their 1 unit of neuro at this 46.25, and then the eval, 1 unit, eval, it's always 1 unit, 9766. That needs to, the amount here needs to make up the rest of 85. So 85 minus 46.25, the eval is going to be 38.75. So the reason for this is the eval you only are doing once, and the insurance wants to see that things are consistent. So if you were to bill the eval as, like, say you divided it by 2, and the eval you did, let's see, 85 divided by 2. You billed 42.5 for the eval, and then you did 42.5 for neuro. And yeah, that does equal 85, but then when you go to treat the patient, say your next session you do 4 units of neuro with that patient. It's not going to be 42.5 for all of your neuro units. It's going to be what the treatment costs. So if this person's treatment costs 185, divide that by 4, it's actually 46.25. So the insurance doesn't want to see that, whoa, why did they bill 42 on the eval, and then on the treatment they're billing 46. This number that you're billing in the treatment always needs to stay the same. So when you do the eval, basically you need to imagine what 1 unit of neuro is going to be during a treatment session. And then the rest is going to be made up by the eval, because the eval price can change. Okay, thank you.